There's breaking news this afternoon. 2 football players at Kansas State have tested positive for coronavirus. Those players will be required to self-isolate for at least 10 days before returning to any K-State facilities. Athletic Director Gene Taylor says the medical and coaching staffs are well prepared for the next steps. The coronavirus is spreading beyond Missouri's largest cities, with a large share of the state's cases now coming from rural areas. Missouri has 228 new cases today. That rural spike is fueled in part by outbreaks in meatpacking plants and nursing homes. The percentage of positive tests in Missouri is now 3.4%. Now in Kansas, it's at 4.3%. Kansas does not release new numbers on Tuesdays. New data from the Kansas Department of Health shows the daily COVID-19 case rate is increasing across the state. Locally, Atchison, Douglas, and Franklin counties were among those with increasing rates. Many of the counties where the cases are going up had a modified phased reopening plan or no plan at all. In Leavenworth, Johnson, and Wyandotte counties, the daily case rate is going down. All of those counties saw spikes early on in the pandemic. Across the country, the death toll in nursing homes hit a grim milestone. 50,000 deaths in those facilities are connected to the pandemic. Experts say the true toll of cases in long-term care facilities is likely even higher due to reporting lags and differences in how states report. The state of Missouri is officially back open. Shutdown orders have officially been lifted. The governor says it's because of expanded testing and expanded reserves of personal protective equipment. He also says the state is watching capacities at hospitals and healthcare systems, and they now have a better ability to predict potential outbreaks. Even with Missouri lifting all of its COVID-19 orders for the past few months, plenty of restrictions remain in place at the local level. KMBC9's Martin Augustine shows us some of them in Kansas City, Missouri.
Governor Mike Parson has said it all along. The local communities are empowered to have tougher COVID restrictions in place than what the state might have. Case in point, Kansas City, Missouri Parks and Recreation Department pools such as the Springs Aquatic Center here, those pools are closed. They will not reopen even with the state back open for business. You have to keep in mind that Kansas City, Missouri still has a COVID emergency order in place that'll be in place through July 5th at least, as it stands right now. Businesses are welcome to be open in Kansas City, Missouri, but they have to keep the number of people on the property at 50% of capacity or less. Restaurants, for example, have a lot of rules they have to follow. Most notably, they have to arrange tables, chairs, and booze in such a fashion as to maintain appropriate social distance. Now, that all being said, we need to point out that Kansas City, Missouri Parks and Rec may have the pools closed, but the parks are open, trails are open, you can reserve shelters, you can go to the dog parks, you can play on the golf courses. So there's a lot of ins and outs to all of this. If you go to my KMBC9 News Facebook page or my Twitter feed, I have links up that'll kind of walk you through all the frequently asked questions when it comes to COVID restrictions in Kansas City, Missouri. Reporting from the Northland, Martin Augustine, KMBC9 News.
In Clay County, Missouri, all businesses and organizations may now allow up to 50% of its fire code capacity. Mass gatherings are to be capped at 250 with proper social distancing. Researchers in England say they have new evidence a drug can improve survival from COVID-19. It's a common steroid drug, dexamethasone. It's been used for decades to treat conditions from altitude sickness to eye inflammation. And now it's been shown to cut coronavirus deaths by 1/3 in the sickest patients. The drug reduced deaths by 35% in patients who needed treatment with breathing machines and by 20% in those only needing supplemental oxygen. It did not appear, though, to help patients with milder cases. Meanwhile, a COVID-19 vaccine funded by the United Kingdom's government is starting human trials later this week. 300 volunteers will receive the vaccine. It would need to pass another round of trials involving about 6,000 volunteers before it could be administered to the public.